Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And in this video, I want to cover this topic of pelvic alignment and or misalignment being the cause of your back, butt, or sciatic problems. Specifically, this is a question I get very often. Does an anterior pelvic tilt cause back, butt, or sciatica pain? And what do I do about it? We're not going to talk so much about what to do about it because as you learn, there's not a whole lot to do about it. Specifically though, I want to make sure this is very science-based and evidence-based. So rooted in science and evidence, not just theory, which so much of what is recommended out there is, okay? So if you're watching this, chances are you've likely been told the reason that you have some type of pain is because your pelvis is out of alignment. Your spine is out of alignment. Your pelvis is rotated or twisted. Your hips are uneven or one leg is longer than the other. You're asymmetrical in some way, shape, or form. Or you have poor posture. Do any of these sound familiar? And this is because you sit too much. You have tight hip flexors. You have dead butt syndrome, or you've forgotten how to activate or fire or turn on your glutes in some way. You have a weak core. And therefore, these are the beliefs that inform the actions, the treatment, the solution. And therefore, because these are the problem, you need to stretch your hip flexors, turn on your glutes, fire your core, realign the position or posture of your pelvis or spine, and correct muscle imbalances in order to relieve your pain. If you've been told that this is why you hurt, and this is why you're still struggling, then you're being told a big fat lie. All right. So in this video, we're going to cover the 9 lies that you've been sold about your pelvic position and the reasons why you do not need to fix muscle imbalances in order to relieve your pain naturally. This is not my opinion. This is based off of the science and what the evidence supports up to this point. All right. Why would someone lie to you? Intentionally? Maybe, right? But at the end of the day, treatments and devices rooted in theory and fear said to fix something broken within your body are much more attractive and easier to sell than those rooted in science, which aim basically to teach you how to fix yourself. Because who believes that they can actually fix themselves? Some people do, but most people say, hey, Charlie, I'm not the doctor. I've got to go see someone else. I've got to get an x-ray. I've got to get an MRI. I should be able to trust that provider who's seeing me to tell me what's going on. But can you really? All right? And this often results in unnecessary and potentially harmful, based in nocebo, treatment. Nocebo is basically to do harm. Again, maybe not intentionally, but at the end of the day, I would argue that if we're professionals here and we're not keeping up with the evidence and the science, then what about that is being a professional, all right? And so at the end of the day, if you're getting certain treatment done within the context of this narrative of your pelvis being twisted or out of alignment, then that is doing more harm than it is doing good. And you're wasting a ton of time, energy, and money potentially, and you could be barking up the wrong tree, all right? So this is the concept, and this is sort of the theory that this idea of fixing this tilt and things being out of alignment might play into your back, butt, or sciatic issue. So kind of a fuzzy picture here, but this is the idea, right? So hey, you've got this tightness on the front side of the body, your iliopsoas or your hip flexor, one of the hip flexors. And then your rectus femoris or femoris goes down, attaches to the knee. These are kind of pulleys or rubber bands that would pull and sort of turn that wheel. If you picture the pelvis, right, this little spoke here in the middle being the center of the wheel. If you have tightness in the front, it can pull the pelvis forward, which causes this to kind of rotate forward and put you in this anterior pelvic tilt. All right, if you can look at me here, kind of tilted forward. All right, exaggerates the curve in your low back. All right, so you can see there, hip flexors pull the pelvis downward, and then your back muscles pull it upwards, they get tight, etc. Right? This is the opposite of that. Right? The idea is, okay, well, if that's the case and that's a problem, then what about treatment could be done to fix that? Right? Well, we could work on the the abdominals to pull it up and contract the glutes and the hamstrings and things like that, and that would create a posterior pelvic tilt. Or would it? All right. So this is said to be the problem. Tight hip flexors, weak abdominals, weak glutes, tight low back muscles. This is said to be, therefore, the solution. Right? If we do some core exercises, we can stiffen up the core. We got to pull that pelvis and help rotate that wheel backwards. And then if we stretch the hip flexors, we kind of loosen the thing that's pulling it forward. That'll help it go backwards too. We can strengthen the glutes as well. And then we can stretch the low back. And if you look anywhere online, this is what you get. All right. You get glute bridges, again, to activate or contract the glutes and the hamstrings. You get hip flexor stretches to loosen up the front side of the chain, if you will, right, and allow your pelvis to not be as locked in that anterior forward position. You do bird dogs to train yourself to be in a more neutral position and also to strengthen the core and improve the coordination, if you will. All right, so this is a typical program said to sort of reverse this anterior pelvic tilt. Another one, right? Very similar, by the way. Stretch the hip flexors, stretch the lower back muscles because those are said to be tight, and then teach you to kind of move out of that anterior pelvic tilt. Backintelligence.com. Nothing intelligent, by the way, about this exercise program. All right. Now, 5 ways to fix an anterior pelvic tilt. Very similar, right? You do back stretches because they're tight, right? You do lunges. You can see it sort of stretches, almost looks like a hip flexor stretch on that back leg. You do some glute bridges because they're not working, right? You do some planks. You do some bird dogs. These things pretty much look exactly the same. This is what is said to correct an anterior pelvic tilt, right? And the issue is, okay, if you have muscle imbalances, then your posture is going to be off. If your posture is off, then your joints are off. If there's lack of congruency because your joints are off, then it causes friction. And look how scary this is, just picture-wise in and of itself. It causes friction. Looks like the disc is sort of falling apart. Looks like the spine is actually slipping off the pelvis, right? This causes degeneration, which then the body communicates as pain. Here's another picture. Okay, if you're really arched, you've got a lot of compression in your lower back, and that's the problem. So, Charlie, it totally makes sense. Look at me, got it, right? Theoretically, everything lines up. If I just fix that, my problem will go away. But will it, right? Does this explanation for why you hurt have any scientific backing, or are you barking up the wrong tree and is it simply made up? Is it a fallacy that is simply made up? It's made up, folks. It's made up. And here's who medicalized the anterior pelvic tilt. Medicalized, meaning made a problem. This person made this anterior pelvic tilt a potential problem and used it as a reason to explain why people hurt. This is Vladimir Yanda. He's a medical doctor and also a researcher. Now, in all fairness to him, right, times have changed, right? And the research, as you'll see here in a moment, actually supports that his approach is, well, not very supported, all right? But at the end of the day, just somebody who was very inquisitive, wanted to think outside the box, and so started to do some research to determine if he could see some patterns here, right? And as you'll learn in a moment, he's the one who sort of developed this idea. He also wrote a book, which makes him, I guess, an expert, right? But he sort of founded these terms, upper cross syndrome. So, you know, if you're looking at the upper body, as you're sitting all day, you could say, oh, I'm getting tight in my pecs, I'm getting weak in my mid back, and so I've got to strengthen these things, and I've got to stretch these things, and this is what people follow. Now you've got lower cross syndrome, and specifically we'll chat about this as it relates to an anterior pelvic tilt. We talked about this earlier. Tight hip flexors, weak belly, weak glutes, tight low back muscles, right? But these terms were founded in 1979, so nothing against the 1970s, right? But it's 2024, so we're talking over 40 years of research and experience, right, since then, and yet we still hold on to these faulty belief systems. And oh, not to mention the website, you can visit his website, aimed at preserving his teachings, right, says, hey, while Yanda was the first to recognize upper cross and lower cross syndrome, few studies have validated the specific pattern of muscle imbalance and postural abnormalities associated with these common muscle imbalance syndromes. Basically, it's not a valid way of assessing and or treating somebody in pain, all right? You can't say, hey, somebody has lower cross syndrome, somebody has an anterior pelvic tilt, and so we're gonna do X, Y, and Z. It doesn't work like that, all right? Humans are a little bit more, in depth, if you will. As it relates to the pain that we experience, we are not just sort of robots, and we cannot just look at things biomechanically. We have to consider the big picture, all right? Now, despite those 40 years, right, you can see here that on the trusty WebMD, it's on WebMD, it must be true, right? Apparently, this was reviewed and approved, but back pain, an anterior posterior pelvic tilt, alters how the pelvic muscles pull on your spine, causing your low back to curve excessively inward or outward. This curve places unnatural pressure on your spine, as if there is a natural pressure on your spine. And as a result, you may experience aches or pain in your lower back. You may, but you may not, all right? Overstretched hamstrings. An anterior pelvic tilt weakens your glutes, forcing your hamstrings to tighten as they work extra hard. Tight hamstrings lead to hamstring sprain. This painful condition occurs when muscles overload and tear. Stomach bulge. An anterior pelvic tilt causes your stomach protrude forward, weakening the abdominal muscles over time. Your stomach may also appear flatter, right? How many of us want a flatter stomach? All right. Look, at the end of the day, there's just so much wrong with this statement. And so let's debunk this here now, okay? 9 lies that you have been sold about your pelvic position and why you don't need to fix it, all right? Number 1. Your pelvis is anteriorly tilted. This is what they tell you, correct? A gold standard for determining what is normal or abnormal position or function of the spine or pelvis does not exist. So what is an anterior pelvic tilt? We don't even know. We can't even agree upon it. So how could somebody possibly tell me, hey, your pelvis is anteriorly tilted if there is no normative sort of measure for that? So this is a research article we'll review now. We'll also review it later. But non-surgical, meaning natural interventions or treatment. So natural treatment for excessive anterior pelvic tilt in people who have symptoms and people who don't have symptoms. A systematic review, a higher level of evidence. Here's what they found. No evidence supports excessive anterior pelvic tilt as an isolated clinical disorder or pathology. No evidence. And a valid cutoff point for defining anterior pelvic tilt is problematic. Is this an anterior pelvic tilt? Well, here's an anterior pelvic tilt according to these folks. And you could argue relatively it is more anterior compared to this person who's more posterior, compared to this person who's neutral, but it's all relative. But again, it will be medicalized. Pelvic tilt is a common condition that causes bad posture, or can cause, right? We don't want to lock ourselves one way or the other. It can cause bad posture, leading to problems with your spinal disc and increasing your risk of injury. It's not true. Is this good posture? What if this position feels good for someone and this feels bad for someone? Then do we say this is okay and this isn't? What if this feels good and this doesn't? What if this feels best? Is this good posture? Is this bad posture? This says it's healthy posture. Is it healthy? Is it not? And this is the predicament that you as a person in pain is going to run into, because you're going to get all kinds of different opinions. Everybody has a different opinion, but when we look at the science and we look at the data, this is what we know. We're not treating this based off of theory. We're using the science. And then yes, of course, some experience in your story to determine what is best for you. But we're not taking a rote cookie cutter approach to this, right? If we don't have a baseline for determining what is forward and what is back, and there's no cutoff for measuring that and identifying an anterior pelvic tilt, then these so-called kind of problematic upslips, downslips, torsions, tilts, rotations, uneven hips are totally invalid because they lack a standard normative reference. To make that simple, without normal, you cannot have abnormal. Without symmetrical, you cannot have asymmetrical. And so just as a compass requires a clearly defined north, if you're in the middle of the woods and you're looking around, you're like, where am I? You've got to have some solid truth and or point of reference that you've at least established to be the truth, such that it can provide reference for all other directions and you don't get lost, right? But without this, you will get lost. So without a standard reference for what is normal for the pelvis and spine, one cannot determine that which is abnormal. This does not mean that these problems may not exist, but rather they cannot be agreed upon or defined. So having somebody say, this is a problem, your pelvis is anteriorly tilted, when we have not even agreed upon how to define that, is a problem. That is the problem. They are the problem, not you. Being told your pelvis is anteriorly tilted or rotated is all relative. Right? So again, if you're going down a path, trying to fix this thing, and you've been fed this belief that, hey, this is what's going on, and this is how we're going to fix it, this is the first lie. We don't have any standard of reference to say, this is forward, this is backwards, this is right, this is left. Therefore, we cannot place this meaning upon your pain and why you hurt. Okay? So all these things, they're dead. Rest in peace. The second lie you've been sold. Anterior pelvic tilt is a problem that needs to be corrected. It's the reason why you hurt, and it is a problem that needs to be corrected. You need to fix it. Do we need to fix it, or is it normal? I don't know. So what we looked at is we assess the degree of pelvic tilt within people who do not have any symptoms. And what we found is that, guess what? Pretty much everybody's stuck in an anterior tilt. Does that make everybody, right, experience pain? Does that make everybody a problem? Should we correct everybody's pelvic position? No. 85% of males, 75% of females presented with an anterior pelvic tilt, yet they had no pain. Interesting. It's not until the development of pain, or the onset of pain, or the experience of pain begins that then do we go seek explanations for why we hurt. And if you seek, you shall find. If you go to someone that this is the only way they see things, they will tell you you have an anterior tilt because they don't know any other way of looking at it. They will put you in a box. And if they haven't kept up with the evidence because they're not a true professional, then you'll be stuck going down a path of treatment which may not serve you. All right. The vast majority of people who are pain-free have an anterior pelvic tilt. So guess what? Anterior pelvic tilt is normal. The third lie you've been sold. Hey, if you're standing like this, it's causing compression. on the spine. Right? And it's due to these muscle imbalances, which alter the posture. And so your posture is off, your joints are off, you're getting this friction, you got degeneration, and you feel pain. The relationship between low back pain and lumbar lordosis, the arch in your lower back, right here, the arch in your lower back and how much arch you have, and the relationship between that and back pain. So is it true? Oh my gosh, Charlie, we've got this compression. That's why I'm hurting. I've got to fix that. Well, what does the evidence say? 2017 in the Spine Journal, one of the most prestigious sort of well-known spine journals or journals on sort of this topic of back pain. And what they found is that there was no correlation, all right? People like this present every day without pain. In fact, if you look at me, I would kind of look like this person. I have no pain, right? But I have what you would call an anterior tilt. That's just the way I stand. Is it a problem? It's only a problem if you make it a problem. And if you don't believe me, you're like, well, I don't know about that. Let's take the most extreme example of somebody who might be really thrown into an anterior tilt or have an excessive lordosis or arch in their lower back to see if they hurt. Somebody who might be pregnant. An analysis of posture and back pain in the first and third trimesters of pregnancy. Right? The further we go along in the trimesters, usually the bigger the baby gets, right? And the more weight and arch that most women develop. This isn't new news. This is old news, 1998. No significant relationships were found between the magnitude of and/or change in posture and back pain. So again, as trimesters go on, the arch generally gets bigger and bigger. But these postural changes were not related to back pain. And this suggests that many of the posture-correcting clinical exercises to improve the muscle imbalance and fix the posture of the pelvis, to get rid of that anterior tilt, need to be investigated and replace many of the posture-correcting clinical exercises given to pregnant women with anybody, with you if you're watching this. You've got an anterior tilt, and you need to do X, Y, and Z. And if we just improve the way that your hip flexors are doing this and your abs are doing this, then we'll fix your problem. Based off of what science and evidence? There is none. Another study between postural asymmetry found in teen and college years and future ability to sort of predict subsequent future back and neck pain. Again, this is old news, 1985, Spine Journal. Looked at a bunch of women, followed them, did initial measurements of how their shoulders were off, how their pelvis was rotated, how they were kind of one way or the other. 25 years later, none of these parameters, nor the evaluations, were associated with or predictive of back pain, mid-back pain, or neck pain. It can be all kinds of wonky, whatever that means, off now, but it doesn't mean that you're going to get worse. It doesn't mean that you're going to have pain. And so there is no correlation between sort of this asymmetry within the system and the things that people feel. Now, it's a little bit off topic, but and a little bit sort of wordy, right? Scientific here. But neck posture clusters and their association with biopsychosocial factors and neck pain in Australian adolescents. Right? So let's take a bunch of people, let's look at their posture, and does the posture predict if they'll hurt? Or is there something else going on here? The most common factors to influence development pain were not posture. We're not related at all to that, the positioning of their head and their spine and their back and all that, but rather depression and stress. You see, pain is so much more than just a bunch of muscles and ropes and bones. We've got to look beyond the biomechanics purely, all right? Again, Spinal Curves and Health, a systematic critical review of the literature dealing with associations between spinal curves, tilts, right, in the forward and back plane. That's what sagittal means, right, and health. And guess what? There's nothing. You can have the biggest anterior tilt and hurt the least. You can have the smallest anterior tilt and hurt the most. Pelvic and spinal tilt is not related to pain. The greens are the truths, if you will, according to the most up-to-date and latest science, all right? Number 4, the fourth lie that you've been sold as it relates to your anterior pelvic tilt. Tight hip flexors are pulling your pelvis into an anterior tilt, causing your pain. You need to stretch them. You've got tight hip flexors. This is what you see all over the internet, right? And again, it's very catchy. But is it true? Well, my PT, he showed me my hip flexors are tight because he laid me down. He did this test. It's called a Thomas test. Maybe you didn't do it hanging off the edge, but maybe your PT did it at an angle. And he said, yep, see, in this one you have good motion in your hips, right? Because it falls below the level of the table. Here, you're tight. This person in 1A is tight. But study after study show that anterior pelvic tilt is not related to tight hip flexors. Rather, it's probably just a preferred way that we move and stand. Comparison of pelvic tilt before and after hip flexor stretching in healthy adults. You can do all kinds of hip flexor stretching. Doesn't really change your position of the pelvis and doesn't really change the arch in your lower back. Stretch them all you want. Relationship between hip extension range motion, meaning how far your leg can kind of drop off the table and how much motion you have kicking your leg back, which is a measure of how flexible the front of your thigh is, your hip flexor motion, and postural alignment. And again, there's nothing. You can have the most flexible hip flexors, and you might just choose to stand like I do, like this. You could have the loosest hip flexors, and maybe this is just the way that you stand, or maybe you don't. All right. There is no relationship there. Relationship of anterior pelvic tilt during running to measures of, again, how flexible your hip flexors are. There's nothing. There's more to the way we move than just measuring the length of an isolated rubber band. Anterior pelvic tilt is not the result of tight hip flexors. And so if you're watching this and you've been told, hey, we need to stretch out your hip flexors so we can correct your pelvic position, show them some of this research. Question whoever is recommending that, because it's not based off science, it's based off of theory. Stretch them till the cows come home and is not related to your ability to kind of correct the position of your pelvis. All right. So tight hip flexors, dead. Anterior pelvic tilt is not related to tightness on the front of your hip. Number 5, the 5th lie you've been sold about anterior pelvic tilt and needing to fix your pelvic alignment. Okay, well, if the hip flexors aren't the problem, Charlie, well, what about my hamstrings? I heard that if I have long and weak hamstrings, my pelvis will be pulled into anterior pelvic tilt, causing pain. So look at me again, right? I heard that if these things are all loose, well, then they can't pull backwards. So as those things get stretched out, it allows me to go into this position. If I just tighten these up, it'll pull me backwards. Will it? Hamstring muscle length and pelvic tilt range among individuals with and without low back pain. Conclusion, we conclude there is no significant relationship that exists between hamstring muscle length and pelvic tilt range during forward bending in both individuals with and without low back pain. These indicate that changes in hamstring muscle length, HML, may not necessarily affect pelvic rotation. Okay, so that's dead. Anterior pelvic tilt is not caused by long or weak hamstrings. The 6th lie that you've been fed about why your anterior tilt needs to be corrected and the problems associated with it is that your weak glutes are causing your pelvis to be unstable, resulting in pain. But is this really true? Right? There's this idea if you have weak glutes, well, then you have tight hip flexors, just like we talked about in the beginning. So if you fix one, then we can fix the other, and my glutes aren't firing. But is it really true? So what we did is we looked at the effect of tightness in the front of the thigh on the ability for the glutes to sort of work, to perform. Right? And what we found is there's no significant differences in hip or knee, what we call extension moments, or glute strength between groups, between people who had tight hip flexors or people who didn't have tight hip flexors. Lack of correlation between natural pelvic tilt angle with hip range of motion and hip muscle torque. Your pelvis can tilt whichever way it wants. Doesn't make your glutes any more or less able to function. Anterior pelvic tilt is not associated with weak glutes, so stop trying to turn them on. Tight hip flexors, hamstrings, no. Weak glutes, no. Good news, you don't suffer from glute amnesia or dead butt syndrome. Your glutes aren't asleep. You don't have sleepy glutes. You haven't forgotten how to activate or turn on your glutes, so stop trying. The 7th lie you've been sold about anterior pelvic tilt. Strengthening your core will help correct your anterior tilt, or will help kind of put your pelvis back in alignment. You've got to stabilize things, right? People hear this every single day. But is that true? Relationships between lumbar lordosis, how much arch you have in your lower back, and, well, that must mean if you're arched like this and these are all stretched out, that's a problem, right? No. Patients are often taught abdominal muscle strengthening or activation exercises, dead bugs, pelvic tilts, all those different things, probably you're familiar with, as a means of altering their standing posture, right? Because anterior tilt's not good, so let's correct that. And the theoretical basis on which this practice has been built is not supported by the data in this research article, as well as anything else we've found, right? No apparent relationship exists between abdominal muscle function, your core strength, or your ability to fire your core, and standing pelvic tilt, again, muscle function in the core, and how much arch is in your lower back, right? There's nothing there. Lumbar lordosis and pelvic inclination in adults with chronic back pain. So people who have chronic back pain, do they arch their back more? Do they have more of an arch in their back or less? In patients with chronic back pain, the magnitude of the arch in the lower back, that's the lordosis, and pelvic inclination and standing, meaning the tilt, is not associated with how well the muscles of the core work. And it's not associated with pain either. All right, so because you have, remember the theory was, this is tilted forward, these are all stretched out in the belly, so they're going to be long and weak. And these are, these need to be strengthened, this needs to be strengthened because these are tight and this is tight. All right, but you can tilt forward all you want. It doesn't mean that it affects how strong or how well your abdominal muscles function. Anterior pelvic tilt is not caused or associated with a weak core, abdominals. So that's dead. There's nothing else to stand on. The 8th lie you've been sold. Sitting causes your hip flexors to get tight, which pulls on your pelvis and causes an anterior pelvic tilt. This is just not true. There's lots of research. This is just one of them. But they looked at the length of hours that one spent in sitting, and they found it was not related to the tilt of your pelvis or how much arch you had in your lower back. And this just makes sense if you think about it. The idea is if you sit too long, you're sitting too long, you're in this position, this gets all tight, it gets all kind of bunched up. It causes hip flexor shortening. But prolonged sitting does not cause your hip flexors to shorten, resulting in anterior pelvic tilt, according to research, and then also logic. Think about it. Does keeping your knees bent all day cause your knees to be like adaptively shortened? Meaning, in simple terms, if you're sitting at a desk all day, like most people are, do you get up and you walk around with your knees all bent because they've just shortened within 8 hours? No, you move around every once in a while and you keep the motion. Does keeping your elbows bent throughout the day cause your elbows to stiffen? I spend most of my day like this, working. Can I not straighten my arms at the end of the day? No, I can straighten my arms because periodically I do straighten my arms. Think of it like this. This sounds a little silly, but this might nail it home. Does keeping your fingers, shouldn't be bent all day, prevent you from opening your hand? How many people walk around like this all day because they're worried about not being able to open their hands? Nobody. All right? Your hands are like this all night while you sleep. Your hands are like this as you type all day. When you grab things, they're always like this. But not many people that I know of have lost their ability to open their hands because of that. All right? So if your fingers aren't permanently stuck in this position, then why would your hips shorten from sitting for 6, 7, 8 hours a day? It just doesn't make sense. If it doesn't occur in your hands, why would it occur in your hips? The 9th and final lie that you've been sold, all right? Correcting muscle imbalances will fix your pelvic alignment, relieve your pain. This is the premise, anterior pelvic tilt being the problem, but then correcting muscle imbalances, being that we medicalize this anterior pelvic tilt, is the premise for many different treatments out there. It's probably the reason you're going to PT and they're giving you hip flexor stretches, core work, glute bridges, all the things we talked about in the beginning. So many different treatment programs are based upon this faulty logic. If we just fix the muscle imbalances, we're going to fix your pain, right? That's a lie. Again, we visited this article in the beginning of the chat here. Non-surgical, natural treatment for excessive anterior tilt. And people have pain and don't have pain. Can you correct anterior pelvic tilt with natural treatment? No. Due to limited literature and in general low quality designs, so you need to look at the quality of what you're reading too. You need to look at who's writing it, right? No overall evidence for the effect of non-surgical or natural treatment in reducing excessive anterior tilt and potentially related symptoms was found. Zero, zippo. There is zero evidence that any form of exercise can change your pelvic position. That's on top of the other 8 lies we talked about, all right? So now, look, you might have one of these yeah buts. I can see the comments now. Does this mean that moving the position of your pelvis is useless to reduce pain? No. If tweaking things, changing things, if manipulating how your pelvis is positioned in sitting or standing or walking or sleeping or whatever it is makes you feel better, then that's awesome. Do it. All right. If you're walking and you get pain and then you do this and your pain goes away, then great, do that. But notice that I'm not attaching a nocebo narrative to it. I'm not backing it by a story of, well, see, that's because your pelvis is this, and so we need to do this, and so we need to do that, and you need to come see me for X amount of visits to correct X, Y, and Z. Instead, I'm saying, hey, does it feel good? You think you could do more of that? Cool. Now, that's likely not the permanent fix, but it gives you and your movement system some different options for finding relief, which is awesome. But again, I'm not linking it to this is good or this is bad. That's just an input that you provide to the system, and it feels better and it reduces your symptoms and allows you to mitigate the pain experience in the right direction, which is great. Use it as needed. But Dr. Charlie, I did exercise to correct my anterior tilt and my pain went away. These are the comments that we'll get below here, right? Awesome. But this is a fallacy. This is a logical fallacy. That's great. If you did something that worked, awesome. We call this post hoc fallacy. It's a logical fallacy that occurs when someone assumes that because one event occurred after another, the second event must have been caused by the first. Right? So I've got this bottle of water here. I'm not feeling all that well. My throat is scratchy for real right now. All right? So let's just say that I have a fever. And I drink this water. And then in an hour, my fever goes away. Oh, well, the water cured my fever. Well, did it? I don't know. Did it not? Let's just say I go for a walk and then my fever goes away. Was it the walk? Let's just say that I wear purple shoes that day because I'm feeling, I don't know, extra excited or something like that. Well, my purple shoes were the reason why my flu or my fever went away. I like to wear flannels. Actually, you know what? I have a hoodie on right now. If I feel better, my fever goes away. Can I conclude that wearing a hoodie is the reason why my fever went away? Now you may say, that's crazy, man. It's not crazy. That's the exact logic that you're applying. The chiropractor, if they say your pelvis is out of alignment, so they label you with a problem, they realign your pelvis, they crack your back. And by the way, they probably just don't crack your back. They also yank on your leg and do this and do that and do all kinds of different things. And then your pain goes away, say later on or something like that. Then you might come to the conclusion of, see, my pelvis was out of alignment. Now, it's great that you feel better, but it could have been many things. It could have been that you like your chiropractor because you heard that they were the best in town. It could have been that it's a sunny day out and it's beautiful and you just feel better. It could have been due to many different reasons. It could have been due to the fact that they just put their hands on you and they spent the time to listen to you and nobody else has taken the time to do so. And so instead of jumping to conclusions, see these things as individual inputs rather than labeling yourself as like, hey, I have this problem, I did this thing, and this is what fixed it, right? Number one, if you're doing more than one thing, it's really difficult to tell if that what you did solved the problem. So you want to be scientific and you want to be systematic. But at the end of the day, step back and just see treatment as different inputs. And if you're finding someone who's saying, hey, you're out of alignment, and they're basing it off of theory, and they don't have the science and the evidence and or anything other than their word to say that, you have to be really careful of that. Because the truth is that you're not out of alignment. You're normal. 85% of males have an anterior pelvic tilt, and they don't hurt. All right? And so rather than medicalizing this problem, we want to normalize it. And the cool thing is that this alone can be a breath of fresh air. If you've been going down the path of trying to get different treatments for a back butt or sciatica problem, and you've been trying to correct your pelvic tilt, even if you've been trying to correct a posterior pelvic tilt or an anterior pelvic tilt, or one hip's this or one hip's that, or you've been trying to correct a leg length discrepancy, and it's not working, then it's not working. Person can say whatever they want. It's not working. You're not broken. You're normal. And so recognize that a biomechanical expert, someone who sounds super sharp and smart in describing how the muscles connect and how everything pulls and does this and does that, they might be sound as it relates to the anatomy and the kinesiology and the mechanics of the system, right? But we have to treat you as a person, not just as a textbook, all right? And so at the end of the day, your pain is an experience. A biomechanical expert does not mean that they're going to be able to solve back pain or resolve it, right? Because we are more than just the body. In case you haven't recognized, there's also a brain and a mind connected to this thing. So the body is the instrument of the mind, and it does what the brain or the mind tells it to do. So when you hurt, when you move a certain way and it hurts, you become fearful of movement. The more fearful you become, the less you move. The less you move, the more fearful you become. The more fearful you become, the less you move, right? And so you've got this kind of negative feedback loop that people get stuck in. And so if you're going down the rabbit hole trying to fix your tilt, fix the position of your pelvis, right? Then you're focusing just on the body side of things, which is fine. But be careful of the narrative that you've been fed, and be careful of buying into belief systems which are not supported by science and instead are supported only by theory. All right? You've got to treat not only body, but then also the mind and or the brain if you're going to have the best chance of resolving this. Okay? So All right, so if you've watched this and you're trying lots of different things, getting lots of different opinions about why you hurt, because your pelvis is this way, that way, you're tired of relying on someone else to fix you and you want to learn how to fix yourself naturally, then I would love nothing more than to review your case personally. Again, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I only help people all around the world, by the way, with back, butt, and sciatic problems. And the goal is to teach you how to resolve your issues naturally using the power of your mind and movement as medicine. So if you'd like me to review your case personally, what I would say is, hey, go ahead, click the link below, somewhere in the comments and or in the description. Basically, it'll take you to a page, you set up a time to chat, then you follow instructions to submit what I call a detailed case review. I will review your case personally. If for whatever reason I don't feel confident I can help, I'll just reach out personally and let you know. There is no cost to the call and or the case review. Why? I do not feel ethical and or right charging people when I don't feel 100% confident I can help. So that is why I will let you know either way I can or I can't, even before you have a call with us. Thanks so much, everyone. Hope you are doing well. Hopefully this was valuable and puts you on the right path to healing. Remember, the goal at the end of the day is to teach you how to lean into and find what works best for you instead of you having to rely on what somebody else is telling you is wrong, which might be based off of their theory instead of science, evidence, and experience. Thanks so much. Chat soon.